Owensboro, Kentucky, a quiet rural neighborhood and home to Mark Tatum, a husband, a father, and a grandfather. Mark's story is one of amazing medical advancements and the triumph of the human spirit over what can only be called the unimaginable. Mark and Nancy were married in 1991. Mark had 2 sons from a previous marriage. For 10 years, theirs was a happy home.
We had just bought this house, and we were working on remodeling it, and we really enjoyed being in the country and being by the lakes.
But just before Valentine's Day 2000, their so-called normal life would take a tragic turn. Mark went to sleep one night complaining of a common malady, a headache. By morning, it had become unbearable. Mark's wife, Nancy, rushed him to a local hospital, where his condition rapidly deteriorated. A call was made to the University of Louisville Hospital, where Dr. Jeffrey Bumpus assessed the situation.
He had the clinical appearance of having what's called mucormycosis, which is a very devastating fungal infection that kills the tissue and can spread very rapidly. In fact, it can even spread to the central nervous system or brain area if left alone. It can become fatal within about a 48-hour time frame. This type of fungal infection is rare. It's in someone who has some chronic interruption in the immune system, most commonly diabetes. There are some medications that can induce diabetes, and that's probably what the issue in Mark's case was, more or less.
I didn't even know such a thing existed. You know, I thought these flesh-eating bacteria and stuff were bad, and this doctor told me, he said, they're actually nothing compared to this. This destroys tissue so quickly. You know, there's no comparison to this. This is like the worst thing that can happen to you.
The fungus lodged in Mark's sinuses and literally devoured his face from the inside out.
The inside of his nose, the tissue was starting to turn black. The eyes were developing a gray membrane over them and turning black as well. And some of the facial skin, actually the skin around the cheeks and the nose, were turning black, and that's because the tissue was dying.
And all this happened within a week. I mean, you know, he was fine, and then all of a sudden he wasn't. And within 2 or 3 days, they were telling me that he probably was not going to make it, that they didn't expect him to live.
With a disease racing toward his brain, Mark's only chance was to get state-of-the-art treatment. So doctors rushed him more than 100 miles to the University of Louisville Hospital. Once there, Dr. Bumpus took over the case. Mark was then offered 2 radical options: to have all the infected tissue surgically removed, including his eyes and a large portion of his face, or to allow the infection to terminate his life.
Mark and his wife talked about this, and Mark's principal statement to me at that time was that you do what you need to do, doctor, to give me the best chances I can have to live. So I took him to the operating room that night, and we performed a very extensive surgery which required removal of both of his eyes, the bone of his nose, the soft tissue of his nose, and essentially all of the mid-facial structures, including the maxillary bones, which are underneath the eyes, all of the hard palate.
What you're about to see are photographs taken just after Mark's surgery. They are extremely graphic. Mark emerged from the 4.5-hour operation with a deep fissure where his eyes and nose used to be. To minimize the pain and discomfort, doctors decided to keep Mark in an induced coma for several weeks.
I didn't actually see the wound without the bandages till about a week after he had the surgery. I think really my imagination was worse than it actually was. So when I actually saw it, as terrible as it was, I was relieved that it wasn't worse. It was really something to see.
After 5 weeks in the induced coma, Mark was awakened with no memory of what happened to him. Next came the daunting task of rebuilding Mark's facial structures. This was the challenge faced by a team of plastic and reconstructive surgeons, including Dr. Zafrullah Khan.
Our intention was to provide him with the artificial palate so he could at least speak and swallow, because till that point he wasn't able to do any of that because he didn't have a roof of the mouth.
Before Mark could receive the artificial palate, the plastic surgeons needed to create a structure to attach it to. This was done with a bone graft, as explained by Dr. Wayne Stadelman.
In a 14-hour operation, we transferred a piece of bone from his leg with the attached skin, plus vein grafts. We put that piece of bone from one side of his cheek to the other to give him a bony scaffolding. And then the skin paddle that went along with that was used to reconstruct the palate.
The most wonderful thing they did was when they reconstructed his mouth, because then he could talk, he could eat, he could drink. It really made it where he had some quality of life. You can breathe easier.
But one quality of life issue still left to deal with was Mark's physical appearance.
I don't think Mark was ever really afraid of what people's reactions to him were, but he was afraid of offending someone, like upsetting children.
Oh, I'm gonna wear these things.
Oversized sunglasses helped, but Mark's cavity was far too large to easily conceal.
They finally decided that instead of putting living tissue into Mark's face, it was such a large area they didn't think it would hold up, so they decided to go strictly with the prosthesis, artificial eyes and artificial nose.
This next phase of Mark's reconstruction was turned over to Dr. George Kushner.
If you go back to what I call the old days, before we had these craniofacial implants, if you had an artificial nose, it was glued on, and the skin would get oily, the glue would slip, and while you were talking, your nose would slide off. Obviously, that's not a nice thing to have. And so we found that by taking the implants we use in the jaws, we can put them in other bones of the face and actually have a prosthesis that is anchored and can't slip or slide off.
During a 3-hour procedure, Dr. Kushner screwed a series of titanium anchors into Mark's skull, as well as into the bone that was grafted above his lips. Titanium was used because its porous surface helps it fuse permanently with bone tissue.
These are nothing, little bony screws that go into bone structure. And once they get anchored into those, then we can build over it.
The result provides Mark with a strong foundation on which to attach his artificial face. Mark's new features were crafted by Dr. Khan.
The way we sculpt is we try to match the other parts of the body. If a patient is missing a ear, we'll go to the opposite ear and try to duplicate it. It's the same thing with eyes. But in Mark's case, since he was missing both his eyes and his mid-face, we took the liberty of using some of his older pictures.
A simple mask is trimmed to fit snugly around Mark's facial cavity. He used a sculpting compound to rough out Mark's features. It provided an early clue as to how his finished prosthesis would look. A mold was then made from the sculpted mask, and from the mold, a lifelike silicone rubber appliance was cast. Realistic glass eyes completed Mark's new look.
We try to make it in such a way it's not larger than himself. Because anything larger, people don't pay attention to it. And also, like if we are making eyes, we usually recommend that patients wear tinted glasses, because with normal eyes, you blink a lot. So we try to minimize that stereo effect from individuals, who are around. And also we like to camouflage borders or junctions where the prosthesis meets the skin. So in Mark's case, what we did was we made him grow facial hair. So that way anything we couldn't hide with his glasses, the facial hair took care of that.
Seeing Mark with a new face, even though artificial, was a deeply moving experience.
It really was dramatic. There was finally a face that went along with the wonderful personality that he has and sense of humor and the jokes and the lightheartedness. It made him complete as a person again. And that was probably the most gratifying moment that I had.
Later, a sculptor named Scott Ficus donated his time and expertise to craft Mark an even more realistic appliance. Taking care of Mark's new face has become part of Mark and Nancy's daily routine.
We usually clean Mark's face once a day, sometimes twice a day, depending upon how much drainage he has from his sinuses. And the prosthesis just It's got magnets here and magnets up here in the top, and they just fit down over and up on these magnets here, and that's what holds it on. That's all there is to it.
Nancy makes it look easy, but there are struggles every day. Still, Mark has adopted an incredibly positive outlook on life.
The tear ducts are gone, and I have no tears, so I cry from my heart just because I can't see. I mean, I think eyesight is very precious. There's a lot of beautiful things, but I'm 45 and I've seen enough to last me a lifetime.
Although Mark can't see how he looks, he is still thrilled with his prosthesis.
It feels good to me. And
Looks good too.
yeah, I hope it looks good to her. That's the only person I worry about.
It does, honey.
She wasted so much time on me, and I don't consider it being a waste because I'm here today to aggravate her. And that's what I think I was meant to do all along, because I love her deeply. I love you, honey.